Walter Perry, the founding Vice-Chancellor of the Open University, had a vision for the university to be at the cutting edge of both education and research, and was instrumental in ensuring that the OU engaged in research in health and well-being. 50 years on, we take a look at some of the exciting work taking place today. This is health and well-being research at the Open University.
My name is Lynne Watson. I'm a staff tutor at the Open University, and I'm taking an education doctorate looking at nursing, nature and humankind. At the Open University, we teach nursing students the art and science to become skilled, competent nurses and to practice at their profession. Their education includes many aspects necessary to become competent, skilled, registered nurses, and that includes a focus of person-centred care. Understanding what that centre is means that as a nurse, whilst you have the deepest privilege of sharing an experience or journey with another person, you also need to blend your professional skills with the beliefs and values of another. The importance of nature for many individuals is linked to the concept of biophilia, which describes the bond between humans and the environment. In considering this affinity, it is important to consider our roots in order to understand the things that give meaning and purpose to life and to living. For many people, it is a connection with their environment which is so important, whether their immediate surroundings, such as where they live and work, or a wider definition such as their town, birthplace, or even the natural world. Aspects such as daylight, being able to see out of a window, even fresh air, are all linked to our experience of nature. For some people, however, this goes much deeper, and as nurses, we need to be mindful of the many situations which make up the lives of our service users. The National Health Service is a great organisation and one which we will all, at one time or another, be grateful for. However, the name of this fantastic establishment should be enough to make each one of us question what is health and what does that mean to us as an individual. Health does not necessarily mean being free from disease or illness, nor does it particularly mean being at the peak of fitness or strength. It could relate more comfortably to well-being or welfare, but in truth, health is as complex and as unique as each one of us. Nature is often seen in context with our emotional health and well-being. Yet in published research, it was noted that physical recovery from surgery was swifter when individuals could enjoy a view from a window. This suggests that hospital design should consider the outside environment, and that this is important in all areas of healthcare. Whilst embracing nature within a clinical environment may be challenging, technology provides us with the potential to create innovative clinical spaces where elements of nature can be included in a patient-centred approach. The inclusion of nature is already being achieved in many areas in the United Kingdom, and we are catching up with other European countries where the importance of nature has already been embedded within healthcare. The broader aspects of nature, like pets as therapy and social and therapeutic horticulture, have formed part of academic discussion, and hospital gardens are once again being seen as an important addition to healthcare. The point is, however, that as we continue to expand our urban and indeed our clinical environments, the place and importance of nature can be lost, and that fact may be to the detriment of us all. Nature plays an important part in the development of the nursing and wellbeing curriculum at the Open University. This presents itself in free courses available through OpenLearn, but also by positively influencing the path to sustainability of the NHS. We may not return to a time of flowers by the bedside, but with advances in technology, the potential to embrace nature as a component of person-centred care, which includes green care as fundamental to humankind, may ultimately result in personalised healthcare environments, building resilience and supporting recovery.